In today's show, I'm going to discuss the good, the bad, and the ugly about two teeth whitening choices that dental practices have to offer their patients. As a dentist, it's important to know exactly how these options can meet your patients' wants, needs, and of course, expectations. Stay tuned and all will be explained. The reality is that from evidence-based research, and despite popular belief, currently there are only two ways that you can safely and successfully whiten teeth. These are in-chair whitening and take-home whitening. Firstly, let's review in-chair whitening. On a positive note, having your teeth bleached in a dental practice saves time and instantly provides whiter teeth. Perhaps. The teeth are bleached whiter within 60 to 75 minutes. Whilst advertisers will claim that in-chair whitening can whiten teeth up to 8 shades lighter in less than an hour, successful cases would be few and far between. It is possible, but less likely. A drawback of in-chair whitening is the higher levels of peroxide being used. This can lead to higher sensitivity levels, and despite using gingival barriers or tooth desensitizers, can still be quite painful for many and make the in-chair whitening, well, less of an enjoyable experience. The secondary problem with in-chair whitening is that whilst the whitening gel penetrates the layers of your teeth, breaking down the tooth stains, it also raises the internal temperature of the tooth, which eliminates any moisture within the tooth. Therefore, the teeth may dehydrate as a result of this procedure. The outcome is that whilst the teeth can initially look brighter, as they rehydrate over the next 48 hours, their appearance can look less white or duller. Tooth sensitivity is also a possible side effect after teeth whitening, and it's often caused by the peroxides used to whiten teeth. This solution can remove minerals within the enamel and cause the teeth to become temporarily porous, exposing microtubules within the teeth. These tubules, called dentinal tubules, are microscopic channels that lead from the surface of the teeth to the center of the teeth, where the dental nerves are housed. When dentin tubules are exposed, dental sensitivity will increase. Finally, in-chair whitening is usually far more expensive than take-home whitening. As a top tip, the secret to more effective teeth whitening is a longer bleaching period or good time on the tooth. And this is why the second professional dental option, take-home whitening, is the preferred option for many. Whilst in-chair whitening, the peroxides used to whiten are only bleaching the teeth for approximately 45 to 50 minutes. Compare this with home whitening. The whitening gel is in contact with the teeth for an hour or a day, or overnight for 14 to 20 days. Logically, which is going to get the better results? But is it all good news for patients when choosing the take-home whitening option? In the main, a resounding yes. Firstly, this option means a patient can use a much lower and safer strength of whitening gel. This ensures it can be safely worn for longer with far less sensitivity. Whether the choice of peroxide requires whitening for an hour a day or overnight for 14 to 20 days, the results are generally superior, more consistent, and longer lasting. There are a few things to be mindful of, however. Firstly, patient compliance. Are they following your precise instructions? If they are not, then there is a chance that they won't achieve their desired results. The good news is that some straightforward protocols can be easily used to guarantee that this happens and they follow the protocols. Secondly, time. As individuals, we can suffer from a lack of time. Unfortunately, whitening is not an exact science, and it's worth explaining to patients that despite what they might have read or seen in advertising, there is not a quick fix to teeth whitening. It's just time on the tooth. So there you have it. The two best options for whitening your teeth are with your dental professional, either in-chair or take-home whitening. Now, if like many dental professionals you can find teeth whitening perhaps a challenge, click the link below and schedule a free 15-minute discovery call with me. I'm Stephen Douglas, and this is your teeth whitening expert.